right. Well, I am Chris Verni. I'm the Dean for the College of Nursing. I'd love to welcome all of you to this Zoom today. I am accompanied by Laura Holthouse, who is the Assistant to the Dean. And between her and I, we are here to kind of give you an overview to the College of Nursing and answer any kind of questions that you may have regarding the program. I believe, if I understand correctly, and you can just chime in if I am not accurate, that the individuals who are on the call today are interested in the traditional four-year bachelor's program for Niagara. If you are not comfortable unmuting your microphone and you'd rather use the chat function, please just look at the bottom of your screen and find the little icon that looks like a talking chat box up there, and then you can just write your comments in there, and either Laura or myself can answer those as we see them. Briefly, I have been at Niagara for just over a year in the dean's role, coming from another institution where I served as dean there. I've been a nurse for 25 years and a nurse practitioner for about 15 of those years. So I can probably answer most questions that students have as they relate to anything kind of healthcare related. The programs that Niagara has are all undergraduate focused, and we'll just talk about the four-year option for you, unless you decide that there's something about the accelerated or the RN to BSN program that you'd want to know. Letitia, I see your hand is raised.
Yes, good afternoon.
Hi.
I was just wondering, so I don't know, I just guess it's tricky. So I'm coming from Canada, or I like to come from Canada to attend Niagara, but
Yep.
by the time I attend Niagara, I would have received what we call my RPN diploma here, which is a 2-year program. So
Yep.
would I be still interested in the traditional 4-year?
So I believe you would be eligible for the 4-year, but I probably should connect you with the admissions department, because there are potential pathways to get you in what I would consider like a 3-year track because of the coursework you've already completed. It's really hard for me to say with certainty because I don't have your transcript in front of me, but I would say that yes, the short answer would be yes for the 4-year degree, but you may be on a little bit of a faster path, just depending on what your coursework looks like. So if you're interested in getting more information on that, I would have you connect to Stephanie Buchkowski, and I can set the two of you up on an email so that she can help me take a look at your transcripts to see where you fit.
Okay, that's great.
Okay.
I appreciate that.
Yeah.
Is there only the 3-year, so there's a 4-year option, a 3-year option, and that's it, correct?
So it's not the 3-year option that I'm referring to here would still be the 4-year program for a candidate such as yourself. We don't have a degree granting program that is 3 years long. What happens is that when there are people who have experience, like for example, coursework that they've taken that will expedite their ability to get through some of the introductory nursing courses, then there may be a path for you to get to the clinicals in a little faster fashion than a 4-year student. But we don't have a 3-year program.
Got it.
Okay, so it's still the bachelor's program. You also, again, I would need to look at that transcript because you also could potentially be somebody that would be eligible for an RN to BSN if the degree you have is an RN degree. And again, I would need to look at the courses and the degree the degree awarded on the transcript in order to be able to discern how that is. And if you had an RN degree at an associate's level equivalent here in the States, then you might be on a 2-year path. But we would need to look at your papers to be able to figure that out.
Okay. And does it have to be official? Like if I were, let's say I set up a meeting in the next 2 weeks, does it have to be an official, or would you guys take the unofficial until the official is?
Yeah, I think an unofficial would be okay to take an initial look, but we wouldn't,
Yeah,
but a student wouldn't be able to enter into coursework until the official was submitted.
absolutely.
Okay?
Yes, thank you. Sorry.
You're welcome. It's okay.
Letitia, I just put Emily Buell's contact information in our chat room for you. She would probably be able to assist you in getting that initial review done. So you can just reach out to her with the information I just provided.
Thank you, Laura.
Okay. So for the other individuals that are looking at a 4-year option, the traditional option, you know, there's a couple very basic things that we can go over. And Laura, do you want to talk to them about getting into the 4-year program first and then me, or?
I can go if you want.
I bet you they would like to hear from you first.
All right, guys. So I'll just give you the rundown and then Dr. Verni can hit you with the other details on the back. There's a couple things that you should know about the nursing program at Niagara. One of them is that it's a direct admit program. So I don't know where you are in your college search, but nursing school tends to be kind of a different animal than some of the other majors. So there's a couple things you need to be aware of when you're looking at schools. So there are schools that do direct admit like us, and then there are delayed admit programs where you go in, you do your prereqs and your sciences, and then you have to apply to the nursing program itself. So if you're looking at those schools, you just want to make sure that you ask them what percentage of your nursing intended students actually get seats in the program. It's just something you want to be aware of as you're looking around. You should be looking around for sure, because then when you land at Niagara, you're going to know why, right? So we're really proud of that direct admit piece. We think that it allows our students to bond better because they're not competing with each other for seats. They come up and support each other a lot better, and it gets it out of your brain. You don't have to be thinking like you're trying to learn anatomy and physiology, you're trying to learn chemistry, you're trying to learn these big sciences. You don't need that in the back of your brain. You know, am I even going to get in? So I'm really proud of that for Niagara. And that's going to lead me to the next piece. Again, you should be looking at other schools. Absolutely. I'm going to hit you a little bit with why Niagara, why specifically NU. And that piece right there, that direct admit, all of the little details that go into our, I guess you can call it customer service. Our students' success, honestly, is our number one goal. We have really high retention rates at the university. We really do make every single effort to make sure that our students are successful and have the resources that they need. I could give you example after example after example of that. And I will tell you this, I don't know what it is about this campus. When I first started working here, I kept hearing about this Vincentian tradition and the Vincentian love and the Vincentian this and that. And I was thinking in the back of my head, I'm giving it about 6 months and it's going to be like anywhere else I've ever worked. And I will tell you that I'm in my 6th year and I am still waiting for the bloom to fall off that rose. It doesn't matter who I call across this campus for any resource for a student, for any schedule change, for anything. Everyone's attitude is, how can we make it happen? How can we get it done? How can we be a part of the student success? So I think we all just feel the same thing. I don't know if it's a bubble over this place or something in the water, but it is really a beautiful thing to come to work somewhere where I really truly feel part of something bigger than myself. And I know our students feel that as well, the way they volunteer and the way they get out there. Our curriculum as it stands right now, your first clinical experience is in the 2nd semester of your sophomore year. Dr. Verni, is that standing?
Yep.
Okay. So you will be in the clinical setting your sophomore year. The great thing about this, it's got so many. I mean, you're going to see all the different flavors of nursing. And the hospitals are going to get to see you but you're also going to get to see the hospitals. You're going to get to kind of like interview them. You're going to get to see the Kaleida hospitals, the Catholic Health hospitals, like all of the healthcare agencies in Western New York, our students are in them. So you'll get to see, what do I like? What do I want to do? And that runs throughout your time here at Niagara. So you really do hit the ground running, and you get a lot of great clinical experience in our program as well. Dr. Verni, I'm sure they're sick of listening to me. We can tag team if you want to hit them with a couple of things, and we'll go back.
Sure. Sure. So students ask me, what do I need to do to be successful in a nursing program? So wherever you pick, we would be thrilled to have you considering Niagara and welcome you here. But really, wherever you end up landing, the information kind of transfers from institution to institution. Most students who are interested in nursing have to have a pretty sound foundation in science. So the science courses that Niagara looks at, if you're in high school or if you've taken some college courses and you're looking to transfer them in and receive credit for those, tend to be anatomy and physiology, chemistry, and if you're in college, there's 2 semesters of anatomy and physiology, and then potentially a microbiology course if you're a student who is further advanced. Now in high school, you don't take those. So for those of you in high school, it's mainly the A&P and the chemistry. We do see the biggest challenges for students in those courses in their first year. So when I meet with candidates like yourselves or guidance counselors from schools, I usually say to them, if you're really interested in a degree in healthcare, you really want to look at how you're performing in those science classes coming in, because understanding how the human body works is truly the key to being a successful nurse, right? Understanding why people have the events that they have, why they experience the symptoms that they experience, and what's happening within their body. Positions us well to be able to teach them how to make that better or how to prevent that from getting worse. So, so the A&P and the Chem are the 2 topics that I would say we look at the closest. Some students ask if we look at SATs and ACTs. We will look at those, but those are optional at Niagara at this point. So they are not something that will make or break your ability to get accepted into the program. The comments that Mrs. Holthouse made regarding students being admitted from day one is really relevant for those individuals who don't want to have to worry for the year or 2 while they're taking the general education courses to see if they could even get a seat, because there's many institutions, there's a lot of people who want to be nurses, right? That is something that we're proud of in the discipline, but it's a very real issue. And some institutions have a challenge where there's too many students and not enough seats in the program. Nursing programs rely on clinical partners, right? They rely on hospitals and clinics and offices to take students in order to train them. And so they only have so many patient rooms. They only see so many people in a day. There's only so many beds in a hospital. So that limits the number of students that nursing programs can take. So at Niagara, when Mrs. Holthouse mentioned that you're admitted from day 1, you start taking those nursing courses early. And even as the curriculum changes, and it becomes a little bit more relevant to 2022, you're still admitted as freshmen. So even if there's not nursing courses being held in a semester, you're still in the program. You are still a declared nursing major. And that is something that many institutions do not do for the reasons that she mentioned. So, that I would say the other thing we pride ourselves in at Niagara is the ability to offer opportunities to students who might not get those opportunities at other places. So we do try to look at the whole student and not just what you look like on a piece of paper. So if you're a student who might be kind of a B student or a B- student, or even a C+ student, but you have a background that kind of shines in your ability to reach a certain population of people. Like you live in a community that is it doesn't have a lot of healthcare people in it, or the community is dying for nurses. You know, you live, I'll give an example. You know, you live on the Indian reservation, and we know that people on the Indian reservation like to be taken care of by their fellow community members. So we will often look holistically at the candidate and say, well, they're not an A student, but they deserve this chance to try to get through the program. And so that is something we've done more and more over the last couple of years. And it really does kind of translate to wins in the community, because, you know, I'm okay with it, but not everybody wants to be taken care of by someone who looks like me. So, so that's a really great thing about Niagara. We use actors in our classrooms to make sure that your training helps you relate to your communities, or relate to your, you know, your desired population. We have, just in this past semester alone, we've had actors come and represent LGBTQ communities. We've had them come represent Indian communities, as I mentioned. We've had homeless people come. We've had people come who are drug addicted. We do all kinds of scenarios to try to make sure that the student experience matches what they're going to see when they leave. And that, again, that starts in the first year. I'm going to stop for 2 seconds because I see some chirping on here. Okay, so I don't need to answer those.
No, you don't. I'll take care of it.
So, yep. So some of the other really great things about Niagara, which I'm happy to showcase, is our state-of-the-art simulation area. We are an approved site from the New York State Education Department to offer simulation as clinical training for nursing students. And so basically what that means is that for some of us, we will go through entire clinical rotations, and we might not see every clinical problem that a human can have, right? We might miss some emergencies. On campus, we can actually create the emergency, and we can create the stressful patient care environments that you will encounter when you're out of school. And that allows students to make mistakes. It allows them to think critically and try to explore how to take care of a human without actually worrying about harming an actual human. And that helps us address the problems in the United States with regards to medical errors and some of the morbidity or the illness that happens when mistakes are made. We have mannequins that we utilize. We use them as early as the second semester of your freshman year, where you are in the labs and you are actually working with a mannequin to do things like learn how to give medications, how to start IVs, how to put in feeding tubes and catheters and things, you know, bathe people, shave people, like the activities of daily living that you wouldn't necessarily know how to do if you have never been faced with the opportunity to do that. So it really is a very hands-on program. And I think the other thing I would say, to kind of piggyback on what Mrs. Holthouse mentioned regarding the mission of Niagara and the community feel that exists here, I would also have to concur, you know, like I said, I've only been here a year, but the level of support that the students communicate to me that they have here, the community of students and how they interact with each other and the resources that are available for you, they really are something that you will not find at many other schools. And I'll say maybe locally for sure, maybe regionally and nationally. I've worked in a couple states, so I can speak to some of those states, but certainly not across the whole country. But just in terms of the relationships that are established here, the class sizes are small, the professors know who you are. When you encounter a challenge, they will work with you in off hours, they will Zoom with you, they will get on the phone, that, you know, the way they go, what I would consider to be above and beyond to make sure that the students are successful, is really something that we are proud of and that you will not find everywhere. So, so I'm going to stop there for a second and just ask if anyone has any specific questions about the program that you'd like us to answer.
Yeah, so just to be clear, nursing classes and nursing activities, just besides prerequisites, do start as early as the freshman year?
Yes, presently, if you're looking at fall of 22 and probably fall of 23, although I say that with a pause, right now, a nursing class is offered in your freshman year in your first semester. There is a new curriculum that we are developing to be a little bit more innovative and to be a little bit more contemporary. And so some of those courses are going to shift into your sophomore year, but you will still be admitted into the program as a freshman, and you will remain a nursing student even if you are taking the psychology classes. And more likely than not, because Niagara is small enough that you all take your classes kind of lockstep with each other, you're taking your psychology class with the rest of the nursing students. So even though it might not be a clinical course or a lab course, you're all together. You're taking chemistry together, you're taking bio together, you're taking math together, you're taking statistics, you know, computers and all of those things together.
Okay, thank you so much. And
you're welcome.
So do you guys accept college credits?
Yeah, so I have to defer to admissions on what is accepted, but I would say in general, oh, actually, Mrs. Holthouse, you can answer that question, can't you?
I can.
You can.
Yeah. We do take AP credits. I don't know if you're from New York, but we take AP credits and we do take transfer credits from other schools. So if you want to, are you going into your senior year this year?
Yes.
If you're looking to take some classes and you want to know if they're classes that might apply to your degree, you're more than welcome to email me and I will gladly give you a little bit of guidance on that. I also have access to a database. So if you've taken any classes previously, I can assess them and see how they would transfer in. The only classes that we can't transfer in are the specific nursing classes. Our accreditation requires all of the direct NUR classes to be taken here, but we can transfer in your Englishes, your writing, some of your psychs, your statistics, all of those we can definitely transfer in. The qualification to transfer in for AP credits is you have to have a 3, 4, or 5 on the exam. And for any other college credits, it needs to be a grade of a C or higher in order for it to transfer in.
Okay, thank you so much.
You're so welcome. One thing I did want to kind of piggyback again on Dr. Verni when she mentioned holistic approach and holistic nursing. The Vincentian tradition that you hear about all the time here, the mission of the university, that plays so beautifully into our program. I love our students. Our students are literally the reason that I get out of bed every day. I love watching them as they progress through the program and their knowledge base grows. By the time they're actually, and again, this just makes me so proud, by the time they're actually working as nurses, they have that holistic approach because it's woven into our curriculum. It's woven into the classroom. So when they're looking at a patient, it's not just a broken leg or a heart attack or whatever it might be. It is a person with a family that lives in a community. All of that comes through with that tradition and with our students. And it makes me super proud. And it is really sought after in this area. Niagara students, that piece that the hospitals know that and they look for that. So I did want to piggyback on that. And when Dr. Verni talked about academic success as well, we have such great resource. I mean, and I know other campuses do as well, but we have such a great academic success center here on campus that has tutoring and academic coaches and really everything a student needs to be successful. There's someone over there. If a student has had accommodations in high school, there's an accessibility person over there that helps them continue those services into the college as well. So all of those things are here. We have a fantastic counseling services center here for students who want to talk to someone. They're right here on campus. It's free to all students. It's amazing. I still have yet, and I challenge the students every year, find me something. Let me know what you need. If I still have yet to find something that a student needs that's not on this campus. So, any other questions?
No, I think Letitia, did you have something you were going to ask?
It was just pertaining to the transfer credits, but
Okay.
But I guess I'd have to again connect with sorry, I forgot her name, but to connect with her to find out if
Yeah, Emily.
Courses would
Yeah.
transfer, Emily, if those will transfer over.
Yeah. Yeah. I'm trying to think of the other big things that students kind of like to know.
I will tell you that it is a great time to be coming to Niagara. Dr. Verni was brought in a little over a year ago as we transitioned from the School of Nursing into our own College of Nursing. So there's a lot of changes going on right now. We've got upgrades in our labs. We've got upgrades in our sim center. I mean, she was barely here a month and I'm going to beat the drum. She got the grant, $400,000. She got a huge grant within months of being here. That is all poured out for our students. We have resources even within the college. Some of our nursing classes aren't necessarily covered in the Academic Success Center as far as tutors go. So we are able to hire within the College of Nursing, juniors and seniors that do tutoring in some of the classes that students tend to struggle with. So we have those all lined up. This year we're firming up our peer mentor program. So every freshman that comes in will have a peer mentor right out of the gate. We've got juniors and seniors all lined up waiting for their names and waiting to meet them after summer orientation. So lots and lots and lots of support.
The question in the chat asks if the classes are in person. I would say that most of the classes are in person. There are a few courses that are offered in either hybrid or online format. During the pandemic, we did transition a lot of our classes to online, but we actually saw the students' performance after they graduated fall quite a bit with online classes. And so most of those classes have since been returned to on ground. I think the undergraduate research course that we offer, that is an online course that you will work with your professor to do literature reviews and things like that. The computer class is currently online, the IT informatics class that we teach nurses about technology and healthcare and kind of the pitfalls and the dangers of using computers and digital technology to service patients. That class is online. Sometimes the professors will do a hybrid format where some of your classes, the days will be online within an on-ground course. And that really just depends on which course and what's going on with the students. The students take their clinical courses. When they get to the clinicals, there are 5 semesters of clinical rotations, and the students will take classes while they're doing clinical, depending on the day of the week. One day you'll do class, then you'll do clinical, then you might do class again. Some programs, some of the courses have a second clinical day, depending on which program you're in and where you're going. It all kind of revolves around a couple different things, but most of the classes will be on the campus. I didn't speak about the clinicals, but just to give you a little insight into the clinicals, I just mentioned that there are 5 semesters of clinical. We all of the students start with what we call a medical surgical clinical. So in general, you're in a long-term care facility or you're in a hospital and you're learning how to do things like bathe people, like I said, learning how to assess them, how to figure out if that heart rate is regular and how to take a blood pressure and stuff like that. From those courses, we have 2 semesters of medical surgical content, and then we move into what we call specialty courses. And those courses involve pediatric patients, where we have students going to hospitals, but we also have them going to camps, and we have them going to schools and learning how to do assessments on kids who are waiting to play sports, and work with developmentally disabled and things like that. We have a community health option where the students are in the community doing things like working in hospice and working in with the visiting nurses associations and going house to house and doing dressing changes and changing catheters and things like that with people. You know, giving IV medications through PICC lines, those kinds of things. The third, we also have a rotation that involves maternal child. So you are in most of the time, either in a labor and delivery unit or an antepartum unit. So maybe after delivery or before delivery. In some cases, we have the opportunity to go to the operating room, go to the emergency departments, go to special clinics like the cardiac cath lab and kind of learn a little bit more about things like scopes when somebody has stomach issues, you know, cancer treatments and stuff like that. And then the 5th rotation that we have is the final rotation for students, and that is a clinical capstone. And that rotation is usually a one-on-one rotation where the students work directly with a community nurse, and they work in a unit where they are charged with taking care of multiple patients and preparing themselves for that transition out of school and into practice. I'm looking in the chat. So
she said, are you teaching the students to use Epic regarding technology?
So in the United States, they use multiple types of technology. The larger hospital systems here use Epic, or they use something called Cerner. The clinics use something called MedEnt, or there's a couple other platforms that they use. They're very similar, but one of the major health systems that Niagara University partners with in Catholic Health, they use Epic. They actually just started. They do use Meditech in some of the, I think they use Meditech at one of the other hospitals, not the big hospital system, but some of the rotations. So it really varies. I hate to even say this out loud. There are probably still some rotations that use a paper chart. Most of the big partners in the community use either something like Cerner, Epic, MedEnt, you know, one of those. So we also have programs that we use in nursing school. So they're none of those. They're not Epic or MedEnt or Cerner, but we use digital platforms to help students just get familiar with using technology for doing things like documenting assessments and giving meds. But, you know, in 2022, you guys are all gonna be like heads and tails above me, even though I helped design the Cerner platform for the Coletta Health facilities, right? So it's ingrained into you. You all use your computers in every class, and you don't carry notebooks around really anymore. So I don't anticipate that it's really problematic for any of you, and you will be exposed to a couple different types of electronic technology as you go through the program.
Sorry, can I ask another question?
Sure.
Thank you. Okay, so regarding the clinicals, so again, so that means it's not child and or delivery. You have your med surge, you have your
Yes.
older adult, and
Yes.
you have your community and your mental health.
Yes.
And then is that it? And then your
Yeah.
consolidation.
No, that's it. That's over 5 semesters. So the first semester we do medical, surgical. The second semester we do the same, but we kind of ramp it up a little bit and we give students a little bit more responsibilities. You might be seeing more complex patients. In your third semester, that is the pediatrics and OB. So you're going to do half of your time in a pediatric setting and half of your time with mother, baby in some fashion. And then your fourth semester is community health or mental health. And we do utilize a couple of the inpatient psychiatric floors that we have here in Western New York. And we also use outpatient clinics. So you might be going to a day treatment center, you might be doing surveys of communities where you're literally just driving around and observing what the streets look like and what kind of services you see, what people are doing when they're walking down the street. If they're homeless, do you see needles on the streets? You know, is it filthy? Is there only a convenience store and there's no grocery stores like that? Those kind of things with the community health. And the mental health, sometimes we're going to drug treatment facilities. We do use drug court so that we go with a nurse and students will go sit in an actual courtroom and see what happens to the mentally ill who are arrested for some kind of crime, and there is a component of drug dependence with them. So we really do try to make the opportunities vary. They look different and kind of give you an overall, just a gross picture of what health issues people have in the world. And then that last semester, the capstone, that final one before you graduate, we generally try to bring you back into medical surgical just so that you have a little bit more exposure. And again, you may see yourself doing time in an intensive care unit or an emergency department or an operating room or a recovery room. And it's just meant, again, to kind of culminate your experience with kind of some sicker patients where you have to think a little bit more critically. You have to use your judgment to try to put it all together, if you will, and then you finish. And then the other thing that I would just add is that one other thing that Niagara does, which many nursing schools do, but not all, is that you have the opportunity to do summer internships. So a lot of the clinical partners say, yeah, it's great that you have 5 semesters of training, but we would love to have you come for the summer and we'll pay you to work as a student nurse under the guidance of a nurse. And many of the places here do that. The VA does that, and some of the big hospitals, they actually offer these opportunities across the country in the US, and you can apply for any of those. And the hours don't count for clinical, but they do give you an edge up on kind of most of the other students who might not be doing those, because it just positions you better because you've had more exposure.
And do students get to pick their clinicals, or is that up to the professors?
The model at the undergraduate level in 2022 is that the sites are assigned by coordinator because there's too many students. What happens is, you and I both want pediatrics, but there's only one bed. So who gets the bed? So we try not to do that too much, just because some of the sites that students think they're interested in aren't able to accommodate everybody's wish.
Everybody's wish, okay.
Yeah.
If I choose to do, I guess, I don't know if I would do clinical because I've done all of those clinicals, but if I chose to, let's say, do my consolidation back home, is that something that I can do? Is that an option that I have?
So if it is determined that your transcript matches something for the RN to BSN program, then you would have, you wouldn't have clinical, you'd have minimal clinical to do. And so your point about the clinicals would be valid. You wouldn't have to do a lot of those again. If you're not eligible for the RN to BSN and you are admitted into the traditional program, then you would have to do the clinicals over. Not over, but you'd have to do the 5 clinicals for us. So that would depend. We are not approved to have students do clinical in Canada at the undergraduate level today. So you would have to come across to do clinicals here, which would mean you would need an I-20. And we could talk to you about kind of what that would look like. But I would say, to just make sure you're fully aware, you would have to come across for those.
That's fine. Okay.
Yeah.
Thank you.
You're welcome. Are there other questions?
How are the scholarship opportunities? Like, would you say there's a lot?
There's,
Just
yeah, there's a lot of different opportunities for scholarship for students. And the financial aid team, who is not on this call today, would be best positioned, but I can tell you that there are nursing scholarships that are available. There are university scholarships that are available. Stephanie, are you able to answer that a little bit?
Yeah, hi, Will, great question. I'm Stephanie, everyone, Director of Admissions here. So thanks for joining us today. I'm a little under the weather, so I'm just staying a little quiet this evening, so sorry about that, but I'm glad to see you here. So for scholarship wise, for incoming freshmen, how it works is when you apply, we will automatically qualify you for merit scholarship money, which is just simply based on you and what you've done. So it's nothing to do with financial aid or anything like that. So it's simply just your average and your SAT or ACT score if you submit them. We're able to figure the scholarship amount with or without scores. So either way, it doesn't matter whatsoever. The range for this past year started at $10,000 and goes all the way up to $24,000 a year. So that's guaranteed money. We let you know your scholarship amount right along with your acceptance letter as well. So you know everything in a matter of, probably about a month's time frame. So we move pretty quickly. So and that money, like I mentioned, is guaranteed all 4 years. But there is certainly, as Dr. Verni mentioned, plenty of other scholarships to look for. And our financial aid office does a great job at working with you, making Niagara affordable. So just make sure that, really staying in touch with us in admissions and your admissions counselor. So we'll get that all squared away for you. Okay.
Thank you.
Of course.
All right. Well, I think if there are no other questions, I think I've covered most of what I normally tell people without kind of bombarding you with information. We've given you a lot of content to kind of think about. I know that I speak for Mrs. Holthouse when I say that if you hang up and you have questions, you can connect with admissions and they can connect you directly to one of us. We can answer further questions about nursing in particular. I think the admissions team can answer any questions that you have just about your life as a student here on campus. And I hope that you consider Niagara, because it really is it's a great place. And our students are given jobs when they finish here, and they are well respected in this community. All right. Well, thank you so much.
Thank you, everyone. Thanks.
Bye,
Thanks,
everyone.
ladies.
Thanks, everyone.
Bye-bye. Thanks.
You can